Good evening. It's my privilege to be here. I'm glad for this invitation and for the opportunity to share what I have learned in the last 12 years. Since almost 12 years, I am in my own practice. It's an ENT practice, ear, nose, throat. And there in the practice, I started to understand what I could not learn in school, what I could not learn in the hospital, and that is humanity itself. You might know that in the hospital, how much time do you have to spend with the patient as a doctor? You just go for a little bit, and then you cannot help the patient because you have no time. And in the practice, I came to understand many things that changed, of course, my practice, that changed the way I view today humanity and how I approach him. So we are going to look in these 8 presentations, which are bound to each other because I want to build a structure so that we can come to see, okay, that's how we work, that's how diseases comes in, and this is what we have to do to avoid and to get healed after we got sick. Because here there is a need of real knowledge so that we can, know ourselves and the cause of disease. So I want to start with 3 cases that occupied me a little bit not long ago. And the first case is a 23-year-old lady, and she has gotten 6 years ago a tumor in her pituitary gland. That's the brain here. And she got a tumor in her pituitary gland on the right side. And the tumor was discovered because she lost her period, because the tumor was producing hormone, and that hormone stopped the other hormones in the body. And they discovered the tumor, and of course, can the doctor say why the tumor is there? He has a hard time saying that. I met her last year, and she came this year into my practice, and we could find out exactly the cause of this tumor. Because if we don't know how humans function, we have no idea how to see and approach him. And I learned in my own practice more and more to see the human being. And then when they present to me with a certain physical disease, because you know the structure, you see the human being is like a phone. It's a bad comparison, but he functions technically. Yes? It's a technician. So it's a very cannot compare this technician with the human body and the human being. But it's a technical thing. And if you know how the wires are going, you know exactly where to look to find the cause for that tumor, so that the person can remove the cause and can get healed. Then I had another case which also occupied me a little bit. The gentleman got a tumor in his right tonsil. This is supposed to be the neck, okay? And on his right tonsil, he got a malignant tumor. And it didn't hurt him, but it started bleeding. And after a while, he went to the doctor, and it was a cancer tumor. It's his right tonsil. And of course, the first question is, how does the tumor appear? This gentleman never smoked. He's 67. He never drank alcohol. He didn't have a bad lifestyle in his last more than 20, 30 years. And he comes to me, and he's a Christian, of course, and he says, there is no reason why I have this tumor. Can that be? It never can be, because we must know that our bodies, like this phone, can never get broken if you don't damage it. Yes, so our body cannot be broken or in dysfunction if we do not somewhere do something that breaks him. But he was quite unconscious to why he got it. Even though he knows my presentations, he knows my approach, but he said, I do not find anything in my life that fits to it. Now I know I can trust nature. If in nature something is not going well, you know it never can be by chance. And it can never be by chance just the right tonsil. So he came in my practice. I mean, he was not coming to my practice. He came to my meetings. I was doing some meetings in southern Germany, and then he came because he's not from Germany. He came to see me. And we could figure out, by God's grace, in less than half an hour, the cause of his tumor. And I told him that he can do whatever he wants. I mean, there are many procedures that you can do with the tumor. You can cut it out, you can burn it by radiation, you can just give chemotherapy, whatever you do just to take it off, that's symptom treating. It doesn't treat the cause. And that everyone is free to do like he wants. But we cannot fool nature to do something in our body and not understanding what we are doing. Because, yes, it might be taken care of that. I'm not against surgery, I'm not against radiation, but if the cause is not taken away, it is for nothing. The tumor will grow back, or it goes someone else, and he finally will die on the cause because it's not taken away. That's why it's so important to know humanity as it functions. The third case is also a very touching case. It's a 23 years old girl. She got a colitis with ulcers all over her colon. And she got this while she was at age 16. And of course, they gave her medication that took off they pushed back the antibodies that are working there on the tissue, on the mucosa of the colon. But after 6 years, in spite of medication, her disease exploded. And she got perforations in her colon. And when you have a perforate colon, you are destined to die. So the last resort the surgeon could do was to take the whole colon from its beginning to the end of the body to save the life. Imagine that would happen to you with 23 years. And the young lady is also a medical student. And we talked. I met her after she took the colon out, and she is very eager to understand the cause, because even though you took it out, if you don't change the cause, something else comes up. Yes, your colon now is gone, but you have many other organs where something can pop up and bring you into dysfunction. So in this case, I asked myself, imagine that when she was 16, the doctor would have known exactly the cause of disease. Would she been spared to do that procedure? If, of course, she would be willing to change. Yes, if she would understand it. Now with 16, you might not understand all things, but you could work with the whole family that they may understand the situation, and if they would implement it, since it's a law, the way we function, those things could be avoided and they could be saved. Now, even now, she had 3 surgeries, and they might put her, they take the small intestine and make another colon out of it, yes, and she might live a normal life if she changed, even though with this great surgery. So the main problem when I started 12 years ago was that I did not know why are my patients sick. Why do they have what they have? And the main problem is that you have never learned to know the human being from its beginning to an end, to understand him, and to say, okay, this is it. So this kind of cases, when I first started, and even smaller one, challenged me to say, okay, I have to find it out. Because if I don't find out the cause of disease, my medical practice is not much worth. Yes, I do some symptoms treating, I can relieve pain, but I cannot relieve things forever. Yeah? So to help a person to take away the cause. So I started to observe the humans. And I think if we are able to take things and analyze them and see how they work. And from the way they work, we can come up with conclusions, understanding how the things are all put together. So my first approach was that I started to talk to my patients. And the talking to the patient gave me a new side of him. Imagine you have 3 patients the same day that come to you with dizziness. And you ask them what's going on in their life right now. And all 3, one after the other, share with you a certain situation where you might think, wow, that's the same situation. That makes them all 3 dizzy. So I started to put in my understanding, I put humanity here, and I took 2 histories. The physical history and here I put all the diseases whenever you are born from, or you have all the symptoms. And on the other side, I put the mental history, or spiritual history, the history of the surroundings of life, relationships. And then I found events in the life of people that exactly were related to their physical disease. And that was my first amazing discovery. That I said they have a mental event, and we will see the other cases, what kind of mental events they had. And they were just exactly fitting to the result that comes up as a physical element in the human being. So I got interested then in humanity, and to not get myself off-road, because even when you observe things, you can get very fast off-road, interpreting things, the same situation, interpreting it in many different types. So I said, I cannot trust my interpretation, but I must trust the laws of nature. That's why I call my presentations the law of life. Because the laws of nature, are they changeable? No. And since the laws of nature are not changeable, you can trust them if you find them out. So I took the law and made it as, so to say, I want to find out what is it that governs the human being. And so the law of life is like a road. And this road, the human being is put on. He can go off-road on either side, can he? So if he stays on the road, how many diseases will he have? None. Because if you keep that law, the function of your body will be correct. Now, the law of life puts on the conditions of life. Are there conditions of life? Or can we just do whatever we want? We cannot. There are conditions of life. And the conditions of life, they are governed by the needs that humanity has. That the human should function correctly, his needs must be met. His needs must be satisfied. And if his needs are all satisfied according to the way we were created, then there is no possibility inside the law to be sick. Now, I try to not speak about disease and health in these terms, disease and health, because these terms are, you can interpret them like you want. So I try to show that if the conditions of life through the needs are met and satisfied, you have a normal function. Because it's function that is determined by the law. So if the needs are met, normal function means you're healthy. And what's then the disease? What would be the disease then if health is normal function? It is a malfunction. Where do we find it? Inside or outside? Yeah. We just need to take here the temperature. We take here the physical needs. And we have here 96.98.6 Fahrenheit, yes? Are we bound to that temperature? Yes, we are bound to that temperature. So we can go off-road on both sides, can we? And so when we get on the edge of the law, we get like a signal that makes you aware you're at the edge. So when it's too hot, you are sweating. When it's too cold, you are freezing. So whatever you do, when it's too hot, what are you doing? Are you going this way or are you going this way? So you go in the opposite direction. And when it's too cold, you go in the opposite direction of coldness. Because if you would follow on this road, where would you end up? In the end, here is death. And death means no function. The human being, when he's dead, he does not function anymore. But until he becomes in the state of death, he gets into malfunction. But if he would know what he's doing wrong, he might return before he gets to death and get inside the law, fulfilling the needs of his body, and then his life would be okay. So for me, it's very simple. As a doctor, what do I need to know? And as a lay person, what do you need to know? Pardon? You need to know the law. Because when you know the law, let's say that's the road here and you have a driver's license and you stay on the road, how much evil can happen to you? No evil at all. There is total security inside the law. But of course, it's not only us that can break the law. There are others that can break it. They can hit us, and yeah. But if no one would break it, and we would not break it, we would be normal functioning, healthy people. Now, knowing the law, I must check out when people come to me when they have a malfunction, where do they go off-road? Yes? That's what I need to show them. And I need to know where they go off-road on their symptoms. So in this situation, I discovered that the human being has a need that I never learned in medicine. And the need of the human being that I didn't learn in medicine was the need of love. It was very strange to me to see that all the events that I took from my patients were going around food, around not having water, or around relationships. What do you think I found out? It was all about relationships. Because through relationships we accumulate a love need. So after 2.5 years, I had to take for me the evidence that the human being needs love for his functioning of the body, and I had to say, this is it. And on the 13th August, I think it was 2006, I said, love is something my patient needs. And because I found out his main issues in life were relationship issues, were love issues. And tell me, love, why do we have no love in medicine? Do you have any idea? Why the doctor never learns anything of the need of love?
You learn on dead people.
Pardon?
You learn on dead people. They don't.
There are many answers, but I tell you what I think so. Because medical doctors are scientists that occupy themselves with biology, with materials. Tell me, can you put love under a microscope?
No.
And say, oh, I find this is love here under the microscope. That's missing for this. And since love is a pure spiritual thing that is only transmitted through thoughts, we leave it out. You see, I never learned. I went a long time to medical school, and you might have been some people here through medical school and to nursing school, but you don't learn the human being needs love, that his liver might function well, that his pituitary gland might have no tumor, and that his colon should have no colitis, no ulcers. We just haven't learned that. That's why these poor cases here that I showed you at the beginning, they have relatives who are doctors, but they could not help. They just shake a hand. We don't know. But if they would consider the need of love, they would find it out. This need is in missing state. You're off-road in your thoughts. And going off-road in your thoughts, how many can correct you? How many doctors you go to and he says, your thoughts are off-road here. You need to adjust a little bit. Getting back to stick to the normal function. So I was surprised, and I'm surprised till today, that so many doctors cannot handle humanity and cannot see his need for love. We just see the physical, but we don't see the spiritual. And I have learned by experience and by observation, but I had to have a law even for love to know how does thoughts and love act on the body. Because if the body needs love to function well, there must be a law that governs that functioning. Because it cannot be just like by any mystical thing. There must be a clear understanding how it works. And so I started it. I knew after 2.5 years my patient needs love, but I had no idea how to handle it. Because I didn't know the law that is behind our thoughts. And so I started to look closer to the physical, to the human physical. And I took the cell as a support. You know, the cell is the smallest part, so to say, in our body, a functioning part. And we have trillions of cells in our body. And I had to know, how does a cell function? That's my question. How does it function, and how does it get into malfunction? And if you don't know the principles of the cell, you never know how it gets into malfunction. So we have here the nucleus with the genes, and we have other part inside, and we have the membrane. Do you know the cell where it is governed from? Is it governed from the genes, from inside, or from outside on the membrane? Now that I put that question so specifically, you might assume, or you might answer and say, yes, the cell is not governed from inside. We could take off the nucleus, and the cell would still work. The only thing it would not work, it would not replicate, so it would die after time. But it would work. So the cell has, the membrane of the cell is very complex, and we have here certain receptors. Is that, yes, receptors? And those receptors, something out from the body comes and puts here on this receptor, and then it changes and gives a command to the cell what to do or not to do. Yeah? So the cell is commanded from outside. And the cell works like a factory. The cell is a very special chemical factory. So we can understand factories, yes? So what's the purpose of a factory? What's the purpose of a cell? So it must produce a product, yes? That product was not there before. But we have to know, how does it come to the end of the product? You know how the so-called autoimmune diseases work? And this colitis is an autoimmune disease. Yes, when you get ulcers in your colon and it's bleeding, you know there are certain antibodies that come and they bind on the receptors on the mucus of the colon. And then they give the command for destruction. They knock here on and they destroy by the command they give. But you know where the antibodies come? Where are they produced? Can antibodies be produced by chance? Can a factory work by chance? No. And can it work by chance that you have antibody only for this part, for the colon? The antibodies don't go into the small intestine, don't go into the stomach, they just attack your colon. So these antibodies are made by factories in our so-called immune system, which has its head in the bone marrow. So somehow there must come a command to your bone marrow to produce antibodies that go and attack your colon. So this is so important. When disease appears, we have a wrong product that makes the disease. But the wrong product is produced on command. It's not produced on chance. So when I have a disease, let's say we take that case where the pituitary gland produces prolactin. That's a hormone that stops the ovaries to work, because, and your uterus because it says you're pregnant. So you have no bleeding anymore. Now you go to the doctor because you have no period after 7 months. Where is the problem? At your uterus or somewhere else? So you have to go to the pituitary gland, and when you are at the pituitary gland, you have to go to the next step and say, oh, who governs the pituitary gland? So you need to have a structure where you watch and say, yes, there is all fine here. In your womb is everything good. Just the tumor in the pituitary gland produces this hormone that stops all other things to work correctly. So that's why when the disease appears, is the cause where it appears? Mostly not. But you see, what do? We see first where it looks like the malfunction is. We don't know where to go to look, except in hormones. You see, in the hormones, people get, let's go to the pituitary gland. And then they make the MRI, and they found the tumor. And of course, they found the high level of prolactin in the blood. And so they said, yeah, someone needs to produce that. And so I want you to just understand, this is a very simple thing. Our body is a chemical factory. And when we are sick, it must not be the place where sickness appears to be the place where you have to search for the cause. But this is the doctors do. If you have a knee problem, you go to the doctor and he makes an X-ray. I just not long ago had a lady. She had two funny things. She came to me because she had pain in her right sinus on her face. The pain was about 5 days, and I don't look just to one place of the body. Even though I'm ENT, I take the whole body as my orientation. Just last week before I came, there came a lady to me and she told me something about her. She has recurrent infections, and now in her sinuses. And now I say, okay, recurrent infections are something that needs attention. And then I said, do you have any other issues? And she said, yes, but they are not in ENT field. I say, it doesn't matter. Even though I'm ENT, I look to all the symptoms that you have. Because I imagine you must have other ones too, because there is a time where you have these recurrent infections, and the body tries to show us his need on different places. And it might be the same need comes up here, and it comes up somewhere else. And the lady, in the case, she was 47 or 48 years old, and she also had 10 days, she had pain in her left leg, the left foot, and pain in the right sinus. Now, both pains come almost at the same time, just a few days difference. So, is there any connection between your right sinus and your left foot? You go to how many doctors do you go? You go at least to 2 doctors, and every doctor does the same. The orthopedics makes a X-ray. Yes? And he finds that she has a bone fracture, a very tiny little bone fracture. No accident, nothing. How did that bone get that line in between? You know what the doctor said? Oh, because you are old, when you're 47, 48, and it's a fracture of tiredness. The bone got tired. That's how you can use that term in Germany, that the bone got tired. And then I said to me, okay, you used only your left bone, your left foot to walk, did you? You just jump around, yes? So how does that happen? It's just pure ignorance. You have to say something, but you don't know why. And so you put in there a device so to keep the, how you call it? Walking cast, and then you wait till the bone heals back. And then she had it here with, I did the same thing. I did an X-ray of the sinuses. And I got out that she had an infection, so to say, a multiplication of tissue in her right sinus. Now, if you know humanity and how the wires are done, you know that both connect perfectly together. And you know that that bone fracture is made by a wrong product. You know how that is? In our bones, we have all the time a balance between cells that take off the bone and cells that build up the bone. Because the bone is a living being. It's not something that is status. Your bones are not old, even though you might be old of age. Yes, the bones are like everything in the body, they get remade. And so you just need to give a command in a certain place so that at that place only the cells that take the bone off and is not rebuilt. And then you have a fracture. You have a line that separates the bone without having any accident that fractures that. Because it's a metabolic thing. It's not something that is separated from the physiology of the bone. And the same thing is when you get an infection of the sinuses, when you have there a growing of tissue, you know that there are, again, cells or antibodies that come out of your immune system and they go directly into your right sinus, and there they do the work making you aware that something is not functioning correctly. So it's so important to understand when we have a disease, where it shows up is not necessarily the place where you have to search for the cause. Because you need to know in which relationship each things in the body are to each other. And those are not heavy things to understand. They are simple, but it's important to know. So I came up with four questions that I put myself when I have a sick person. 4 questions to find out the cause. Because we have a cell damage or we have a malproduct, we have a damage. The question is, does the damage come A, from inheritance? Can we inherit diseases? Yes, because we come from the past. Our bodies come from the past. They're not new, they're just new assembled, and they come from the past. That's why you can inherit a broken factory. Diseases that are inherited are not healable. because the cause is in the time before your existence. That's why you have to just stick with it. And so many diseases today we have said are inherited. And when you say you have inherited it, what can you do about it? Just suffer them or do some amelioration, but you cannot remove it. But fortunately, we have not many inherited diseases. In my estimation, it's about 2 to 3%. So if we would have just people who have inherited diseases, medicine would have no challenge today. The challenge is not in inherited diseases. Those that challenge us today is, heart problems, cardiovascular problems, yes. Then you have depression, you have anxiety, you have cancer, you have the allergies. You have diseases that none of them is inherited. So the first thing when people come to me and they have their symptoms, I say, okay, inherited or not inherited? So can the tumor be inherited in her right pituitary gland? That can be inherited. Can that be inherited? By no means. Because it can be healed. And everything that can be healed is not inherited. Okay? Because inheritance comes, you come up with a broken factory, no one can change that after your birth. You have the Down syndrome children. Can you change that? No, you have. So that's why inherited diseases are that's what I first rule out. The second thing is, does the damage come from environment? Now, with environment, I mean not the poisons or the radiations. I mean by environment those things that are needed for the cell to function. An environment of the cell is needed for, that's pressure and temperature. Is that fixed for the cell, the pressure and the temperature? Yes. And if we break it, then what happens with the cell, with the factory? It's broken. So we have to figure out if people have an accident, and then now they come, and then when they have an accident, how much can you do about the cause? Can you take the cause away? No, it happened. You just know there is power in nature, and you sustain nature to heal back. Yes, when you have a bone broken, you know you can eat certain fruits that have much calcium or other things that supports that putting back that bone into his place. So these are the accidents that come into my practice. They are not so many. Then the third question I put to myself is, the factory that it might work needs something or not? Can the factory make any product out of itself? Can it? No, so it needs raw material. And since the factory is a chemical factory, what are the raw materials? It's chemicals, yes? And that's water, oxygen, food. They are the chemicals. So can we get sick by putting in the wrong or not the missing thing for our factories to produce the product. Yes, if iodine is something simple to understand, and we have our thyroid dysfunction, we might know if we do not eat enough of that, we get a problem. So there are diseases that come from the wrong raw material. And here I would also put in the poisons that exist, because they take the place of the real thing. Yeah? That's why I would say the poisons are not environmental things, they are chemical things, they're raw material issues. That's just so does the damage come from raw So do you think that we can take one of these three cases and tell them what they have to eat better so they get their cause down, away? So can we put this lady on a diet? Yes, we can. But would the diet change the cause? Why not? Because you have a one-sided thing in both cases. And how can food or chemical just go into the right pituitary gland and they don't go into the left one? So we can always adjust things by food. Because at the end, in our functioning system, it's all chemistry at the end. So we can give certain food changes, certain changes in our food habits, and we might even remove the tumor. But would we remove the cause? And this is where it gets difficult. Because by law, you have the same amount of everything through the blood in your body. And you cannot say, oh, this is it, or this is it, or this is it by changing the diet. You can just remove symptoms. Because, you see, what do they give here for the colitis? They give cortisol, yes? Or other medications that pushes away the antibody. But the antibody is still produced in your immune system. So that didn't stop with your medication. It just removes it from here so the tissue can recover, but when the body has overcome the barrier, the things comes back. Even though you give the medication, because the body at a certain place overrules your medication. Because the input is still there. It is not changed. So I could not say that these two gentlemen, or the lady and the gentleman and this lady, has an issue with their food. To tell them, look, if you change this, your tumor will go away because you missed the right chemistry. So that's why we come to the last question. And that question I just got out in my practice. Because that question is not put in medicine. And the question is, who runs the cell with power? Where does the power of the cell come? Does a factory need power? Is the raw material the power? It cannot be. Because the raw material is used to produce it, but who governs the cell to produce much or less? Because you see, the most things in our body are produced on demand. Not just, just do production. No. It's just on demand. And then it's produced, the demand comes, you start eating, and then you have your saliva, yeah? But do you have a saliva when you don't eat? No, because the saliva is produced on demand. You have your hormones that needs to take the digestion into. Do you have them before you eat? They are there, some are produced, but they are always released on demand. You see, when we sit still, do we need much raw material? No, but if we run, we need more. So, who runs the cell? Who runs the factory? And I tell you a story that learned me a lot about the power or the, how you call this, the governing. Because a cell, a factory cannot govern itself, can it? So I had an interesting case of a lady, she is 69, and she has diabetes type 1. And she got this diabetes type 1 when she was 65. And she came to me with her 69, so 4 years later, and she had a very modern device, a insulin pump, so that you don't need to put your insulin in, you have a pump. And her pump was so good that, to say so advanced, she had 2 sensors in her skin that went down below the skin and measured the blood sugar every 20 minutes. So if your blood sugar is measured every 20 minutes and they send then the result to the device, and then you can see it on the display. And she showed me that display, and I said, wow, that's interesting. So a question came up in my mind, and I'm so glad that I put that question. Because you see, she can see how her blood sugar works. Can we do that? No, we cannot know when it goes up or when it goes down. But she can see it because every 20 minutes it is measured. So I asked her, have you ever observed what happens with your blood sugar when you have a spiritual event? And of course I was thinking on a stress event, but she told me a joyful event. And that even gave me more understanding of the human body. She said, oh yes. She immediately was with me. She said, oh yes. When I hear that my grandchildren come to visit me, I am very happy and looking forward, joyful to that. And then there are 2 arrows that show on my pump that the sugar goes down. You know, they have always a higher level of sugar. It's 156 or something. But they don't need to do anything about that. But when they have a spiritual event, she can see that joy brings the sugar into normal. How do you like it? You see, one of the difficulties that medical doctors have is with diabetes patients. Now we put a whole program together with them. We do not just change the diet, we put them on working and so on, which is good, but can that govern insulin in your body? Can that bring the balance that you need? in. Is the balance done by chemistry? You see, if the balance would be done by chemistry, if we would say, okay, this is the food you have, and this is the amount of insulin you need, and we would put that into the system, how should it be? It should be perfect. Does it work? No. Because you can eat nothing and your sugar goes up. It goes very much up, and you could eat and your sugar goes down. Because the sugar and every single metabolic thing in your cell is governed by your thoughts. So, and the lady tells us which thoughts are fitted to our pancreas. Which are the best thoughts? Yes, joyful thoughts. And joy is a part of love. So that is amazing for me. That's what I discovered then on, that a human being needs love as a government in the body. It's the power that comes that says do something or don't do something. And sugar is one of the best examples for that. Because there are so many diabetes patients, you cannot put them on insulin to check their sugar. And there was a doctor, a colleague of mine, had a patient, and he wrote me his story. But there I learned how you can interpret the story wrongly. He said he had for long years a diabetes patient that was on insulin, and she had always high long-term insulin, how you call it, HB, the A1C, yeah? So she had it about 8.5. I don't know if America is the same, but it should be normal by about 6.5. And she was taking her medication, everything was fine, and the doctor couldn't figure out why she had for years this high sugar. Because during the day, the sugar was normal. During the day, she had no jumping because she was measuring it. Now, after a half a year, the sugar became normal. She takes the same medication, no changes at all, but her sugar levels, her A1C was 6.5. And the doctor says, what's happening? And so he asked her, thank God the doctors can put questions. He asked her, what happened with you? What happened a half a year ago? Because since then you have normal long-term sugar. And then she says, my husband died. I don't laugh. It's not the death of the husband. But usually people laugh when I say that. But you know, the husband was sick, and she needed to awake each night to help him go to the toilet and take care for him. How do you like it when you are best sleeping and someone wakes you up? Is your sugar going down or up? Is that a high stress level? Yes. But unfortunately, my colleague came to the conclusion that it was the lack of sleep that made the blood sugar to be not in control. You see, that's how you can show or can interpret things in different ways. For me, it's clear your blood sugar goes up by your mind and what you think. And it's a hard task to be waken up every night when you sleep maybe best and take care of your husband, no matter how much you love him, isn't it? So now that he's passed away, she doesn't have that stress level during the nights anymore. And so, of course, her blood sugar is on long term okay with the medication. She's not solved her issues, but the story shows, and this is my main point that I want to make tonight, that we all might understand. Every metabolic thing in our bodies, all those trillions of chemical factories we have, must have a governor that makes them to run in a certain way. And that governor is our mind that is expressed by thoughts. And tell me, do we have evidences, because I believe we are here more in Christian environment. In Germany, I don't use the name of God, but when I speak about love, about who do I speak? I speak about God always. Because if God would have created humanity, tell me, what would run humanity? Love must run humanity. And you see, if we don't have love that runs humanity, where is God for health? Is he there? Not at all. It's amazing for me. But the Bible says, and I have a Bible verse in my practice. I put it from the beginning there, even though at the beginning I didn't understand that Bible verse. That Bible verse says, a merry heart is good like a medicine, and a broken spirit dries up the bones. Tell me, was Solomon wise? In one small Bible verse, he puts in everything you need to live. So, in the New Testament, we find another doctor. I call him Paul. And he gave a prescription. He said, how often should you be joyful? Always. Have you ever seen a Christian that is always joyful? You see, if Christians would obey the Word of God, to be joyful all the time, how many dysfunctions would they have from their thoughts? Because I tell you, joy can never damage anything in your body. Love, thoughts of love that you have towards others, can never do any harm to your nervous system. But other thoughts, they can do it. And we will see that in the continuation tomorrow. We're going tomorrow to see where is the place where we find the thoughts and the feelings, and where is the place where the government is made. And so, step by step, we will go deeper and deeper till we get to the point to show exactly that 9 out of 10 diseases come from one specific thought. And if we would be able to control that thought, then we would be able to control ourselves, our livers, our pancreas, our stomach, everything in our body. Of course, not taking off the other ones, would function good. So, a little exercise for tonight. Would it be good? To go home joyfully? Yes. Even though it was a little bit long. But let us think, how can we have an attitude of joy all the time? Wouldn't it be good? I know grandmothers, they are not happy when the grandchildren want to show up. Their blood sugars doesn't go down, that goes up. So we should be able, especially as the people of God, to have an attitude of love and joy How often? All the times. May God give us that grace. Thank you for listening.